welcome. We have distinguished list of past award recipients present here today and have received many apologies. We welcome past recipients Professor Jeffrey Rosenfeld, ACOBE, Alfred Surgeon, Professor John McNeil, Monash University, Gareth Andrews, Life Again Foundation, past RCM member Dr Margaret Leggett, AM, and current member Susan Barton, AM, Lighthouse Foundation. Thank you all for joining us. Would members again please join in welcoming our guests. We have visiting Rotarians, visitors and guests of members. I invite you and your host to stand when your name is announced and ask that you please remain standing to enable the club to welcome you in a collective manner. So we have Ioana Balasa, guest of Ramona. Thank you. Will Abdo, guest of myself. David Fernie, welcome. And Victor Wong, guest of Bernie McIntosh. Please join me in making all of our visitors, guests welcome. Now it's my pleasure to ask Jim Orchard from Around the Bay team to come to the podium to update us on an event and to draw our bike raffle for the Smith Family Learning for Life program. Jim.
So the 2023 Round the Bay bike ride was successfully held last Sunday, and for those of us who were part of the event, we were very lucky with the weather. We had no wind or rain and pretty mild temperatures, so whoever organised that, a big thank you. There were about 7,500 riders this year, which included 9 Rotary Club of Melbourne riders, and the event required about 200 volunteers to be held, and about 50 of those were Rotarians or associated with Rotary, like my wife and my son. So it's likely that we were again the largest source of volunteers, and the event would have been difficult to be run without us. One of the key roles we provided were sag wagon drivers who followed the peloton, as it were, or the peloton, and helped anyone who was sort of struggling. So our six sag wagon drivers did a double shift, which made it a really long day, so special thanks to those folks. We also provided over 40 route marshals and rest area attendants, most of whom helped riders in the Albert Park, Port Melbourne area, but a few more widely spread. We were able to keep most of the riders on track and following where they were supposed to be going, but there's always a few riders, it's always the rider's fault, not the route marshal's fault, of course, who got off track, so we had to do a little bit of backtracking. A good portion of our volunteers have been long-term supporters of the event, so a big thank you for their long-term commitment, and a personal thank you from me for stepping up again and doing a great job. But we also had a few new volunteers, so thanks to those folks, and I hope anyone that was new had an okay day. As has been the case for many years, our involvement in the event has been to raise funds for the Smith Family's Learning for Life program, which aims to help kids from disadvantaged families reach their education potential. Some of you may recall listening to Alira, who was with us about 2 months ago, and I think she gave a great insight into what the program's been able to do for her, and hopefully you can extrapolate out to get a sense of what the program does. So in summary, we had 9 riders in this year's event who were sponsored by 28 club members, and we also had 50 on-the-day volunteers for whose efforts we receive a donation from Bicycle Network. And in combination, so thanks to all of those, in total sort of 80 plus people, this is a big part of our fundraising for the Smith family, and it's also a big promotion, I think, for Rotary and the Rotary Club of Melbourne. So thanks to everybody. So my next and perhaps most important duty is to invite Reg and Dr Sandro Demaio to step forward and draw the raffle. And you may remember the raffle is for a $2,000 bike voucher So it could be a part payment on a really good bike, or it can be a bunch of smaller bikes. I believe I can. So the winner of the, no, well, there may be someone here who will challenge us that. So the winner is Bernie McIntosh. And I guess my work here is done.
Thank you, Jim, and all involved in that magnificent activity last weekend. Just a few notices now. The AGM notice to all. Last week, all members were emailed by our Honorary Secretary, John Saunders, calling for nominations of candidates for the club's Board of Directors and other positions for election at the annual AGM scheduled for Wednesday, 22nd November 2023. Nominations may be made in a number of ways, but in writing, each nomination to be signed by the nominator, other than the nominee, and another member of the club, and to carry an acceptance of the nomination signed by the member nominated. The newly elected members will serve for a period of 2 years, 1st July 2024 to 30 June 2026. To be eligible to serve as a director, a Rotarian shall be an active member in good standing in the club. Nominations must be received in writing by the Honorary Secretary, in writing by 2:10 p.m, Wednesday, 15 November 2023. Moving on to the Community Service Award. Our annual Community Service Award recognises a tireless volunteer with a cash prize for their organisation and a plaque designed by sculptor Michael Mezaros. Annually, we seek nominations from the membership. Should you have any suggestions, please reach out to Philip Cornish of the Community Welfare Selection Committee. Second Bite, calling for volunteers. It's back. Past President Robert Fisher has asked I repeat the request from Second Bite for volunteers to help with collections at Paran Market on a Sunday afternoon. Collections at the Paran Market have resumed and are improving week by week under the supervision of founders Ian and Simone Carson. More volunteers are sought for less than an hour on the occasional Sunday afternoon, either those who helped in the past or new volunteers. Anyone interested in being added to the roster, please contact Robert Fisher. And now to the business of the day. Would our Chair of the Day, past President Reg Smith, come to the podium?
Thanks very much, President Chris, and members, visitors and distinguished guests. It's marvellous to have you in the room and so many of our members here as well. I'm delighted to have the privilege on behalf of the club's Vocational Service Committee to introduce this year's Vocational Service Awardee, Dr Sandro Demaio, who I know is known to quite a few people in this room. My introduction is based directly on the citation, which is being presented today and will be published in our weekly bulletin next week. Sandro's career began as a medical doctor at Melbourne's Alfred Hospital after graduating with his Bachelor's of Medicine and Bachelor of Surgery from Monash University. His further academic achievements include a master's degrees in public health from Monash, doctorate of philosophy in global health, focusing on non-communicable diseases from the University of Copenhagen, and postdoctoral fellowships at both Harvard Medical School and Johns Hopkins School of Public Health. I think you would join me in recognising that as quite a distinguished academic career. But then we come to his professional experience, which is extensive as well. A medical officer for non-communicable conditions and nutrition at the World Health Organization, Chief Executive Officer of the EAT Foundation, the science-based global platform for food systems transformations, and his current role, of course, is as one of our most important public health officials as Chief Executive Officer of Vic Health, the state's peak health promotion body, where he oversees a staff of 70 people, multi-million-dollar budget, and direct health promotion, sports and community grants, and health research. Sandro's focus is primarily on chronic non-communicable diseases, and these are important because these are things that through our own choices we can manage ourselves if we make the right choices. But yet there are still many people affected by chronic disease, perhaps unnecessarily. This passion of Sandro's led him to co-found the NCD Free, a global social movement against chronic disease, which reached more than 2.5 million young people in its first 18 months. And in 2018, he established the Sandro Demaio Foundation, funded by his media work and focused on improving the health and nutrition of young Australians. He has published more than 30 scientific papers and 110 articles, and he also authored The Doctor's Diet, which some of us, I'm sure, are familiar with, a cookbook based on science and inspired by love of good food. The work of his foundation through events such as the Little Festival in Federation Square in April 2023 highlights Sandro's passion for conveying accurate and important, easily accessible and tangible health messages to communities. Inspired by his vision, his foundation looks to engage those beyond the public health echo chamber, translating evidence-based research into language everyone can understand. His foundation values collaboration opportunities with new voices and new partners, amplifying projects of others and building its own programs. Overall, it works to bring system reform to legislation, business and the community. Sandro's distinguished public health contribution, recognised by this award, above and beyond service, his professional work as a doctor and leader of an important state government agency have illustrated, exemplifies the Rotary ideal of service above self. Having achieved excellence in pretty much everything he does, Sandro joins a distinguished body of men and women who over the years have received awards from this award from the club. Please join me in welcoming Sandro, and I'd ask Sandro to join us now on the podium with President Chris for the presentation of the award and the plaque, and then we'll call on Sandro to tell us his story in his own words. Thanks very much, Sandro.
Sandro, it's my pleasure to present to you the Vocational Service Award. Thank you.
Thank you. It's always slightly humiliating when people read out your bio, but I really appreciate. So I'd just like to start by acknowledging the traditional owners of the land that I'm standing on today here in Naarm in beautiful Melbourne. What an incredibly stunning day outside. The Wurundjeri Woiwurrung people of the Kulin Nation and their elders past, present and emerging, and of course acknowledge any First Nations leaders with us today. I think more than ever, not to become political, but politics aside, I think more than ever, a world with more hope could not be, I think, a more pertinent, timely and important ambition for us as a country and indeed as a world. This week, this month, even this year, the importance of hope, the importance of forging a path of trust and respect, of continuing to appreciate and protect our democracy, and of course, finding ways to ensure that every Australian enjoys the best possible quality of life. I really commend that ambition of Rotary. I also will just acknowledge the past recipients of the award, President and other members who have made today possible. There's always an army of people behind the scenes making the magic happen, as I like to say. And I'd also like to really start by actually acknowledging all of you in Rotary. I was reflecting on the way in here Rotary, one of those organisations that kind of quietly in the background are doing amazing things to improve the health and lives of so many, not just across Australia, but around the world. And I was reflecting on actually 3 times that I've had the pleasure of working with the Rotary Network in my professional life, and I wanted to quickly share those, and then I'll talk about my career for a moment. So the first I remember was back after the Boxing Day tsunami in Asia, and I travelled with a group of medical aid doctors, and I was a medical student actually at the time, travelled and worked very closely with Rotary colleagues from across the world in remote Sri Lanka, delivering and supporting the recovery efforts, and saw firsthand the important work that's funded, supported and delivered. The second, I actually travelled with Rotary to Ankara in Turkey, probably about 10 years ago, probably about 10 years ago, working with the local Rotary groups to look at ways that we could more effectively support people living with diabetes. And the third most recent, well, it's actually not the most recent, but the third that didn't happen in my life, but actually the way that you've improved and supported someone very important in my life. My partner is a paediatric oncologist at the Children's Hospital, Olivia, and you actually sent her to Gallipoli about a decade ago, and she still talks about that experience and the important formative nature of being able to travel as part of that delegation. So a thank you from me, a citizen, but also a leader in the Victorian community, and acknowledging the important work in health that Rotary continues to do. So as mentioned, I'll talk a little bit about my career. I also just want to make it very clear I'm terrible at lots of things. You know, bios always make it sound as though you're great at everything. You should try and see me on the football field, not a chance. So no hand-eye coordination whatsoever. So I would want to share, I suppose, 3 insights that have been critical to my leadership experience. And I share this with a sense of humility. I'm still early career. I'm making lots of mistakes. I'm learning to manage a complex team in a complex environment, trying to address complex systemic issues of inequality that ultimately result in poor health. So I grew up in a big Italian family, as many of us, from a strong cultural heritage. I always joke I'm part kind of nonna, part doctor. No one can leave my house without being well fed and a big takeaway container of food. Otherwise, I get deep anxiety. I inherited that from my nonna. So I grew up in a family, an Italian-Australian family that was dominated by doctors. My dad and my mum were both in the clinical field, deeply interested in community returning valued care to the community, but also with a deep passion for food. And over time, these two converged and became really the focus of my career. So I went to medical school at Monash University, one of the best universities in the world, and I'm very proud alumnus, and acknowledge both the professors who contributed enormously to the university. And during that time, I had the opportunity to take a road sort of less travelled and go to a conference in Hong Kong. Now, I'll be honest, at the time, it was probably as much the dumplings as the opportunity to meet new and interesting people that led me to put up my hand. But I got to this conference in Hong Kong of international medical students and realised that there was this incredible international world out there that I wanted to be part of, thinking about bigger problems, thinking about bigger solutions, and aspiring for, I suppose, hope, but also change at a grander scale. As I continued medicine, though, I worked at the Alfred Hospital in the emergency department. I was in Mildura and Sale. I worked in Mount Isa and Doomadgee and Mornington Island, and found myself in Cambodia and Sri Lanka, as I mentioned, working alongside Rotary a number of times. And what I realised was that the vast majority of patients that I was seeing, the vast majority of pain and suffering that I was encountering, and the vast majority of the burden disease that I was trying to treat were from diseases that we fundamentally knew how to prevent. So here we were in an overwhelmed often, or at least at strain healthcare system, one of the best healthcare systems in the world, but under incredible pressure from diseases that we ultimately knew how to significantly delay. It wasn't rocket science. It wasn't something that needed a Nobel Prize. These were basic things that we weren't putting in place. What I also realised was that if you take your genetics out of the picture, 80% of health outcomes for Australians are determined by factors outside the healthcare system. So it's not actually doctors who brought the major gains in life expectancy globally last century. It's not the doctors who brought the majority of health improvements for populations across the planet over the last 100 years. It was lawyers, usually, economists, agroecologists were learning how do we get more food from less land, how do we feed people, reduce hunger, and ultimately also how do we change the way we design our cities, and also in particular ensure that water is safe and accessible to reduce waterborne disease early in life. So as I looked out to the next century, I realised the majority of the disease I was there treating was preventable. The majority of health outcomes are not actually shaped by the health system, and that it's probably not going to be doctors that are going to make the significant health improvements at the population level in the century to come. So I suppose my first lesson in leadership was, it was important to think outside the square and not necessarily tread the same path or tread the path that you feel you have to tread. So I left clinical medicine. I first went overseas for a year to Denmark. I ran a national, I fell into the opportunity to run a national survey in Mongolia funded by the US government, and had 3 incredible years of living between Mongolia, the most rapidly emerging, the fastest growing economy in the world, a country that was going to go through an urbanisation process of 70% rural to 70% urban, a process that Australia went through in probably about 200 years in 2 decades. So a rapidly changing country, incredible capability in its public institutions, a really strong commitment to public health. And then I spent the other half of my time in Denmark at my home university in Copenhagen. And from that, I learned, first of all, how to deliver, I suppose, very large, complex projects. This was first national health census, but also reflecting on Denmark, a country that has a similar income and population size to Victoria, very similar genetics, and yet an obesity rate a third of Australia. And why was that? What could we learn, and what could we take to other jurisdictions, including through the work I was doing at the time with the Mongolian government? Anyway, that led, I published my PhD a year early because of this wealth of information from Mongolia, and launched a social startup. And this was really lesson number 2, that if you want to create change, leadership is a great multiplier of impact. Most of us only have 24 hours in the day. And so I realised fairly quickly that if we wanted to have a scale at pace, at a population level, going alone, I might be able to go fast, but if I really wanted to go far, I needed to build a team and learn how to lead, which we're not taught in medicine. So I launched a startup called NCD Free. I found myself at Harvard for 2 years doing my postdoc, and continued to really focus on honing my, I suppose on one hand, my communication skills, working with multilateral agencies, including the United Nations, and on the other hand, keeping a foot in the agile sort of startup space for health. Eventually, the pull of the United Nations was too strong, so I left Boston and moved to Geneva. I was there for 3 years as a technical advisor to governments based out of the World Health Organization headquarters. And my focus was really on health policy, nutrition policy, so working with countries like Mexico, Germany, Uruguay, China, Thailand, to think, well, how do we put policies that we know work in place, in practice, in the political economies of health, to be able to achieve better health for populations around the world. I was privileged to be able to work on the United Nations Decade of Action on Nutrition and actually write the sort of basic blueprint for what is still a live UN decade now, and also developed the first innovation strategy for WHO, which led to the establishment of a global program. finally, though, love and family. After a few years in Oslo running a global foundation brought me back to Australia, and the opportunity to lead Vic Health was one that I was very keen not to miss. So Vic Health is actually a piece of policy innovation that Victoria should be very proud of. It was the late 80s when the John Cain government, I think with a lot of courage, decided to increase the tax on tobacco by 0.5%, hypothecate that funding, so ring fence and protect that funding, and give it to a fairly small, at that point scrappy, we probably still are in some ways, agile government agency. So we work with government, not for government. We're a statutory agency enshrined through a piece of legislation, and I have community members on my board, which is a governing board, a functional board that represent the people of Victoria who I work for. We're really focused on the question of how do we keep Victorians healthy for as long as possible. And I suppose in particular, how do we make sure that the growing discrepancy between lifespan and health span, that is that the average Victorian will live on average for 13 years at the end of their life with pain and suffering from diseases we largely know how to prevent. How do we close that important bridge? So the final lesson of my health journey was that while it's difficult and messy, linear paths don't usually get us to where we need to be, particularly in a public policy context. And ironically, actually, a training as a physician where you're focused on the interplay between multiple complex and interdependent dynamic systems, whether it's the renal system and the cardiac system and the complexity of each of them and how they work together and the fact that one influences the other, but they're also influenced by exogenous factors, is pretty much exactly what we do in public health. It's the combination of different factors and systems that ultimately result in the health of populations of Victorians. And that's really been the final lesson, I suppose, that I wanted to share today, that as we look out to our next 10 years as an organisation, really, I suppose, reflecting the idea that while it is about personal responsibility and while we do need to empower Victorians with education and understanding of what makes a healthy life, we also need to look at the wider systems that sit around individuals and make sure that they're able to afford and access and enjoy good food, that they're able to walk or cycle safely to work, and that they're able to grow up in an environment where their attention in the digital space is not sold off to companies that are ultimately selling diseases we know are associated with chronic disease. These are some of the really complex, challenging issues that involve, community-led approaches, but also top-down policy and government leadership. So as I close, just thank you very much for having me. I always, when I talk to young leaders, I talk about my 3 Ps of leadership, and I think, they reflect the theory of change of Rotary incredibly well. The first is privilege. There is a huge amount of privilege in this room. The power of bridging capital, the idea that a connection across social ecosystems can really change the trajectory of a young leader, unlock an enormous amount of potential. I've been hearing about the great work that you're doing through things like mentoring, but also in particular intergenerational mentoring, but also across different cultural sectors. So the first is understanding and really utilising the privilege that we have, right or wrong, as individuals in certain parts of society. The second is really finding your purpose, and I think that's very clear today. There is a strong sense of purpose, and hopefully mine has been very clear too, because when you can align the privilege that you have with the purpose that you've found, that's when you can truly do powerful things, and that's the 3rd P. So thank you again. Hope has never been more important. I'm really privileged to be able to accept this award and look forward to staying in touch.
We've got a few minutes for, thank you, Sandro. I learned several things I should have known. Thank you. We have a few minutes for questions, and Sandro's quite happy to tackle those questions. The microphone is coming around, so please wait if you stand and are signalled. We've had one already signalling a couple. Please introduce yourself, your name, and then pose your question. Thank you.
Jeffrey Rosenfeld, past recipient of this distinguished award, and congratulations on receiving it, and thank you for your address, wonderful address today. You didn't mention mental health. Clearly, mental health is an increasingly recognised problem in our community. What can we do to prevent the, it would seem, epidemic of mental health issues in young people, particularly children, so many on medication for so-called ADHD, so many suffering severe anxiety and depression at a young age? What can we do to prevent this happening, and what is Vic Health doing about it?
Yeah, thank you. And I'll just acknowledge your work and service over a very celebrated career. So it's a very important question, and it's a big focus of the work for us at Vic Health. So following the Royal Commission, Victorian Royal Commission into Mental Health, which we were very active in making sure had a focus on prevention, we undertook a review of sort of what works in preventing. So people think of mental health as something that you can't prevent. Now there is a genetic factor, and part of it will always be, to a degree, something we have to manage. And getting our healthcare system, and particularly the mental health care system, as robust, effective, and of course efficient as possible, needs to continue to be a priority for government. But there are a number of things that are proven to work when it comes to population-based interventions for mental health. There are some obvious things like addressing discrimination, and particularly at the moment, again, coming back to your focus on hope. So, addressing race-based discrimination, gender-based discrimination as key drivers of poorer mental health across communities. There is evidence that just calling out racism as a public health issue leads to public health and mental health benefits at a population level, but also going beyond that, and that's something that we're very focused working with a number of diaspora that I know you're also working with, including throughout metropolitan Melbourne. The second is this rise in social isolation that we're seeing. So despite being the kind of most connected generation in history, we're seeing this enormous spike in social isolation alongside psychological distress. And we saw that documented in the data that we were collecting throughout COVID. And in response to those two things, we actually invested in a program called Future Healthy, which was co-designed by young people for young people across Victoria. And one very large investment was through the arts sector. So I think we often forget that, again, 80% of health outcomes will be determined by factors outside the healthcare system when you take away genetics. So working with arts organisations, cultural organisations, even working with community sport organisations to upskill them in mental health literacy, to make sure that they understand when to escalate and how to manage this more difficult environment, a rise in burden, but also, I think, to a healthy degree, somewhat healthy degree, a greater acceptance of being able to have conversations about mental health, and then be able to also see the co-benefits of these programs, whether it's, as I said, a major arts investment across a number of sites in Victoria, engaging young people, trying to build hope, a sense of agency. There are a range of other things that we're doing too, but it gives you a flavour of some of the work in the mental health space.
Thank you, Sandro. Rotary Club of Melbourne is involved with a program helping young people with trachoma, which is an interesting illness, third world problem. My wife recently said to me, why would we, Rotary Club of Melbourne, get involved in trying to assist in this very serious problem? Asking the question, what are governments doing? Would you like to comment at all?
Well, I assume on the second part, not on why Rotary should be involved. But I did recently see, so Bill Gates actually was recently asked pretty much the same question you were asked. And he gave a really fabulous answer, and it's on YouTube. So check it out. in terms of why we as privileged, wealthy people who are not affected by a lot of the problems we're concerned about should be concerned about those problems. And one of the answers is because, of course, addressing inequalities is good for everyone. And that's the same no matter what source of inequality we're talking about. In terms of the issue of trachoma itself, it's really a question probably for you and the Department of Health. We don't work in that space. But I think the broader issue of a continuing and unacceptable, complete divergence in opportunity based on where you live, what your cultural background is, or even more concerning, whether you are a proud member of the oldest continuous culture in the world, in a country as rich as Australia, is something that we shouldn't be proud of and that we need to address, regardless of what political side you found yourself on the weekend. I think, again, coming back to a sense of hope and optimism, we can do better as a nation. Trachoma shouldn't be an issue in Australia. There is a very strong bias for certain population groups, and that's not in any way because of vulnerability or a lack of hard work from those groups. It's because of a lack of opportunity, and one that we have to address, I believe, fundamentally as a nation.
Sandro, Bernie McIntosh, thank you for your address. Your observation about, in comparison of Denmark and Victoria and the differences in obesity levels there, I'm assuming that's a fairly, as in say the last 50 years, maybe there's been a divergence. Would you care to make any further comment on why?
Yeah.
Yeah.
It's a fascinating one, and people will say, Denmark's flat and it's homogenous and it's a small country, and so there are differences, but actually there are remarkable similarities between Victoria and Denmark. So as I said, similar GDP, very similar genetics, because the Vikings went back and forth to England for about 300 years, and similarly robust healthcare systems, world-class healthcare systems. And the divergence really only started about 20 or 30 years ago. So Denmark actually was a very poor country, as I'm sure you're aware, largely an agricultural kind of backwater, they call it that, not me, in the middle of last century. And then there was this huge divergence where Australia went off on a path of increasing chronic disease and this growing discrepancy, not only between kind of have and have not, but also growing discrepancy between the years of life we live, which for the first time ever in human history may be starting to come down, by the way, and the years of life we live in good health. So that kind of started to diverge. In Denmark, they did a number of things, and none of them are simple, but none of them are particularly complex. So things like there is a law in the urban plan. So there is no health consideration in the planning laws in Victoria. There are tighter rules in Victoria about how close you can build two pharmacies to each other than two McDonald's. And in fact, this week alone, I know of 3 towns across Victoria who are fighting multinational fast food giants at VCAT with public money, and will probably lose because they're trying to keep another junk food outlet out of their small country town. That shouldn't be the case. Health needs to be integrated into the planning laws. In Denmark, they're half a century ahead of us. In fact, there's a law that every citizen must live within a certain distance of a fresh food outlet, and the density of junk food outlets is capped. In Australia, there are 2.5 times as many junk food outlets in poor neighbourhoods as there are in rich. So that's one example. A second is, if you've ever walked on the streets of Denmark, you're not worried about getting bowled over by a car, you're worried about getting bowled over by a bicycle. They have fundamentally reimagined what is transport, and the path of least resistance as a PhD student, I didn't even think about buying a car. It was easy, it was simple, it was safe, it was affordable, so I went everywhere on a bicycle. I haven't ridden my bicycle since I got back to Australia. And so, they're all just different examples of social policies. They're not particularly complicated in theory, very difficult in practice. And it was a Norwegian minister who once said to me when I worked at the United Nations, "Sandro, we know what to do, we just don't know how to get re-elected after we've done it."
Just very quickly, David Cram here. We have an arts committee here and so my question to you is, what's your favourite success story, the arts being helped by Vic Health?
Oh gosh, well, I mean, I would love for you to meet Liz, who runs our Arts for Health program. And my favourite one, so I was up at Arts Mildura just recently, working there. We've got a program that's supporting young people, and young people particularly from the large Aboriginal community, to develop a range of experiences based on kind of hope and future that will be rolling out across Mildura over the coming summer. So maybe we can connect my arts team and your arts committee to come up with some fun plans together. Right, thanks, Rich.
Sandro, thank you for a very incisive address, and for taking on some pretty interesting questions as well. My takeaway from this is that we really do need to think about community-wide, government-wide solutions, because many things we do adversely affect the health of the community, and you put some texture to that I'd never even really thought about, and I suspect a few of us might be in the same boat. So thank you for coming and addressing us so effectively today, and we certainly wish you well on your mission. And I'd ask all members to join me now in saying thanks enormously. Okay, I'd now like to just close the meeting with a few announcements. Firstly, thanks very much for all of our helpers who've helped to turn this meeting on today. Anthony Bottoni, who's done a great job in emceeing, Barbara Urondes for your very thoughtful reflection, and of course the lunch setup team who usually do quite a lot of the sweat well before the meeting. So well done, everybody. A quick plug for the Vocational Service Committee. They're the people who manage this award each year, and a number of others. And I've been asked to say we always welcome new members. Anyone who thinks this was pretty cool, let's see if we can be part of it. Please feel free to tap me on the shoulder, or Marglesa Casper, who's sitting at the end of the table there, or Deb Yin Fu. Okay, so a reminder that next week we're back here at number 35. Our guest speaker will be Ben Northey, Principal Conductor in Residence of the Melbourne Symphony Orchestra. Please reach out to your music-loving friends and partners to join us.